Hello, everyone, and welcome to this Labostix broadcast. A Labostix broadcast as part of a Labostix release. A Labostix broadcast part of a chartered edition and evidence-based perspective. A Labostix broadcast part of the Communicade, and a Labostix broadcast part of the broadcast edition, and another Storm Labostix production. As part of this, Labostix broadcast, there will be an overview, a sort of an overview, sort of an overview looking at electronic patient records or EPRs, library services, and multidisciplinary team meetings and MDTs, and where the collaborators around this work sort of originally asked the question: is it not time to integrate primary care for the better? The collaborators around this works were between a social media platform, a social media platform organization, um, a a primary healthcare service provider in context of um, a general practitioner in the southwest region of the United Kingdom, and where collaborators had a sort of cross collaboration with colleagues in the United States, in Washington, in around this works as well. And This original works have been peer reviewed and published in the International Journal of User Driven Healthcare in around 2014. And so, as part of this Labostix broadcast, a sort of an overview in line to this. So, patients or service users with long-term conditions, account for sort of 50 around 50% of general practitioner appointments, around 64% of outpatient appointments, and around 70% of hospital sort of admissions, or hospital admission, in around 70% of hospital admissions. And there needs to be sort of a broader access to knowledge and understanding, such as directories, information based guidelines, documents, books or resources in line to aspects of particular aspects around sort of constructs around aspects of medicine, helpful sort of or helpful links to particular where service users and providers are can are sort of are sort of are signposted accordingly, and sources of information that can support service users and the general public on the most important aspects of their of healthcare. This cannot be achieved just through where service users accessing healthcare records, for example, healthcare records in context where service users, just for example, just accessing healthcare or electronic patient records. And so the objectives around this sort of collaborative works was to highlight the importance of integrating general practice or general practitioners or general practice electronic patient records with for example, library services, aligned to library services. And they also explore why it would be advantageous to implement sort of service user centric multidisciplinary team or MDT meetings in context of primary care for service users with long-term conditions. So the collaborators provide a UK glance specifically um, uh, and uh, um, and also where collaborators provide a basis sort of from a primary around primary care services sort of from in context of primary in context of primary care service sort of more sort of globally as well, and where and in a where in and around where aspects of primary care services could be improved or integrated for the better. And having access in around this works again, collaborators had highlighted, for example, having access to electronic patient records, EPRs alone will not help or encourage patients to gain confidence and or understanding, especially if patients or service user can be overwhelmed by aspects of healthcare choices, and for example, where retrospectively there can be health literacy complexities. Service users whose first language, for example, is not English, approaching more sort of approaching more aspects in aligned to to support to link or to integrate aspects of health literacy is or would be sort of at least sort of retrospectively would be or has been challenging. And so in context of library and health services partnerships should be initiated, allowing access to allowing access to uh, sort of uh, aspects of sort of literacy literacy services, and uh, and where uh, where in addition service user centered multidisciplinary team meetings should be or could be encouraged at dedicated time points between service provider and service user, and where these can could take place within, for example, library-based settings involving participation in aligned to particular care pathways or care plans, and given so collaborators highlighted in this works that given that more service users and the public have opportunity for example, access electronic access access electronic patient records or the health records, for example, a health related literature, a libraries and healthcare sort of partnership could help integrate primary healthcare service better, thus allowing all to access health related literature, for example, books, leaflets, and digital media in sort of environs in that also have staff or professionals that can support in line to health literacy and tech. An electronic uh, patient record, EPR and MDT sort of initiative should be integrated or should be encouraged between library and health partnerships, and this and this is where collaborators had sort of highlighted that this sort of a library and healthcare sort of partnership should be encouraged. The collaborators highlighted in this works as well some sort of main points if you like, of what of how the collaborative works has it has added context, or contextualized um, uh, sort of a basis in around works in around works that is similar, around similar works as well, and where the main points are thus. Uh, there is where number one, there is sort of a more requirement for general practitioners to enter dialogue with other services to prompt integrated services aligned to primary care. Number two, electronic patient records need to be sort of supplemented by decision support, personalized care planning, and and sort of educational aspects from a sort of integrated educational sort of basis from health professionals, as well as those aligned to other services, sort of signposted services. Number three, and there needs to be sort of neutral environs where service users and professionals can um, can join can join to provide a more of an awareness in around electronic patient records, for example, and in addition, where in a neutral environment where service users and the public can also gain additional literature around aspects of disease, in around human disease, sort of accessing literature, etc. At number four, around this collaborative works, the collaborators have highlighted service-centered multidisciplinary team (MDT) meetings would allow service users to service users to sort of gain more sort of electronic patient record awareness, and sort of an understanding of what sort of laboratory investigations, for example, laboratory investigations of parameters, and laboratory parameters sort of actually mean. Number five, general practitioners, for example, should seek to pioneer and implement sort of a sort of service user centered MDT meetings in for example, library environs where one general practitioner where one general practitioner for example, from a practice can call on colleagues from between healthcare sectors at to meet, for example, at for example, library based sort of environment where service user is also called in for review, for a review, and this could be sort of piloted for service users with particular sort of conditions, since they may have several sort of comorbidities, and who may require sort of further support, further sort of awareness in aligned to electronic patient records, EPRs, and aligned to sort of health literacy, and at the same time, at the same time, where a rotation, a sort of a rotation system would allow sort of a more time for general practitioners to spend with service users at primary care level in environs that where for example service users traditionally or retrospectively may find for example intimidating. Another point, number six, around this health literacy is predominantly a skills-based construct, and that does not sort of include sort of motivational aspects, as so and using modes to improve health literacy alone to determine the needs of service users and simplifying instruction for them as a result may be a barrier to that person, thus affecting service user and service professional relationship. And number seven, there is an ongoing requirement to there is an ongoing requirement to see sort of an integration between between sectors, but also between different services within different sectors as well. Once again, this works was collaborative, and so there was in the original works there is perspective there are perspectives and examples from the colleagues from those colleagues and collaborators from a United Kingdom perspective and also a United States example as well. This works also highlights some aspects aligned to the some issues with sort of current practice, at least how collaborators had documented and highlighted some of these some aspects sort of from in around this work sort of retrospectively, and once again this works is uh, um, is available through the renal patient support group, the RPSG, and again the works was retrospectively published in the International Journal of User-Driven Healthcare in around 2014. So again, this has been a Labostix broadcast, a Labostix broadcast part of the Communicade, a Labostix release, a chartered edition, an evidence-based perspective, a broadcast edition aligned in aligned to another Storm Labostix production. Thank you for tuning in.